I'm Mary Pepino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. You all are familiar with my little guy Salvatore, and the reason why he's in my opening today is because he's a big player in de-stressing, and that's what the show's all about. Research has shown that in order to be effective in adopting a healthier and more fit lifestyle, it's not about starting a diet, it's not about starting an exercise program, it's about starting with managing the stress in your life, how you can avoid too much stress and how you can manage the stress that's just a part of our everyday living. I'm going to be joined by two very dear friends and probably two of the very best in their respective fields, Dr. Michael Lileas and Dino Ruse. I hope you enjoy the show. It's my pleasure to introduce my dear friends and the most experienced and respected professionals in their fields, Dr. Michael Lileas and Dino Ruse. Michael Lileas. Michael, we're so happy, dear, to have you back.
Thank you.
You're like our Dr. Oz. Dr. Lileas, if you all remember from many, many shows, founding partner of Salem Internal Medicine, former hospitalist for Prima Healthcare, associate professor of internal medicine at Neo-UCOM, and now the hospitalist for Southwoods Surgical Center. Plus, shortly here, you are going to be board certified in sleep medicine as well.
Providing I pass the boards.
As I'm sure you will. So we have to do a show on that because we know sleep is so important to good health. So we'll put that on the burner for next year.
Sounds good.
And Mr. Ruse, yes, licensed massage therapist, and Dino and I go way, way back.
Yes,
because
we do.
When I started lifting weights many, many years ago, and Dino was not a licensed massage therapist yet.
Right.
We were going to the same gym, meeting there sometime around with everybody else about 5:30, 6 o'clock in the morning.
Well, it was
yeah, you got there, yeah. And so anyway, we sort of evolved into where we are today together. So honored to have you both as my guests, and I think we got the best team going here to talk about stress management and stress and healthy living. Dr. Lileas, we're going to start with you. Stress research, first step in adopting a healthier lifestyle, stress management, because of the physical aspects and the mental aspects of what it does to the body. Medical aspects of stress involve the adrenal glands. What do they do? What happens?
Well, basically the adrenal glands, you can think of them as kind of like the timekeeper or the peacekeeper of your body. You've heard of the fight or flight syndrome?
From you.
Okay, well what this is basically is, you know, when someone gets scared, you're walking down a dark alley, somebody jumps out, and all of a sudden you're scared to death. That's when your fight or flight system comes into being. The adrenal glands do that. What happens is cortisol is produced in the body, and you all of a sudden get a rush of cortisol, a rush of adrenaline, and you've probably heard stories about people that see their kid get run over by a car, and they all of a sudden go over and pick up the car. They have the strength to pick up the car. That's because of the cortisol, the adrenaline. Okay, that rush. Mm-hmm. Well, that's our fight or flight. Well, now what they're saying as far as stress goes is anytime you're under stress, whether it's an emotional relationship, whether it's stress at work, stress at home, stress with the kids, any little stress that's chronic, you're going to get these little blips of cortisol and adrenaline that constantly are bombarding our body that aren't really supposed to be there. Now, that being said, cortisol and adrenaline are always produced in the body, but they're produced in smaller amounts. When people are under stress, you're getting larger amounts. Those amounts are going to start to affect things. For instance, the cortisol will affect the insulin production. So you have cortisol, all of a sudden, here's your level, starts going up. Not supposed to go up at this time, but it does. What does that do? Well, then it starts increasing your insulin production. Well, what does that do? Well, that increases your sugar production. And that goes to your liver, and your liver starts producing, it's what they call gluconeogenesis, where your liver starts producing more glucose than it can handle. So then the pancreas shoots back and starts producing more insulin. But then all of a sudden, what happens? The insulin's not working. It's not getting to the receptors. So now you have an insulin-resistant state. This is where you're going to start to have fat production.
Yeah, because cortisol, we hear so much about when you have cortisol in your body, and I know there are some things advertised, take this whatever over the counter, and it'll fight body fat, fights cortisol. How does it all work and come together?
Well, basically what you have to try to find to do is get something that's going to stop that production. You got to stop the production of cortisol. Not literally you're going to stop it in your body, but what you're going to do is try to reduce the stress to stop these small amounts of cortisol to be produced all day long, because it's not supposed to be there. It produces in what's called a circadian rhythm. In the morning your cortisol levels are high, then it goes down low at night, then it comes back up when you need it, and in times of stress. But your body's not supposed to be under stress 24 hours a day.
So there are times where, and I'm a firm believer in this, I think stress is a part of life, and there are certain stresses that you need to manage and that are a part of life.
Right.
What we don't want to do is be overly stressed, or I think as you phrase it, in a constant state of stress.
Right.
And that's I think one of the problems with our world today and our lifestyle.
Absolutely. If you are under constant stress, let's say that you have a job that you just don't like, and you go to that job day in, day out, and you can't stand it. You're there for 8 hours. All day long, all you're going to be doing is you're going to be under stress. Those cortisol, adrenaline, increasing your insulin, increasing your sugar. It's bad for you. Mm-hmm. And those things, that brings you to this point about these cytokines, okay? These cytokines are they're proteins and glycoproteins that are produced by the body in times of stress. Mm-hmm. Like if you're exposed to viruses, if you're exposed to stress, these cytokines are produced. Well, some of them, if they're produced in too much, then they're going to reduce the anti-inflammatory properties of the other ones that are produced. Mm-hmm. So it gets to be a negative feedback, and it's a vicious cycle.
Let's talk now one of the ways to deal with stress, because my most favorite way, a healthy lifestyle, diet, exercise, and, stress reduction, commitment. Stress reduction is my fave, mm-hmm. because one of the easiest ways is massage. You lay on the table and just enjoy the massage. So to me, it's wonderful. In your research, too, Dino's going to touch upon it. I believe you touched upon massage reduces
cortisol.
Which is perfect.
It's wonderful. So, you're wondering, how can you fight stress? How can you reduce the excess cortisol? Okay, there it is.
Okay,
Massage.
So Mr. Massage Therapist, yes, tell us how you do this. What happens?
Well, first of all, stress. We look at stress. Stress is anything that changes neurologic function, the speed, the rapid. You were talking, doctor, about sympathetic. Well, there's a parasympathetic nerve ganglion, too, that are more your rest and repose.
You need to define those for our audience.
Okay.
Or at least explain in layman's terms what they are.
Doc, why don't you take that over?
The sympathetic system is what's going to, the adrenaline, the norepinephrine, these are neurotransmitters that when they're produced, they're going to increase your heart rate, they're going to increase your blood pressure, they're going to stimulate you. Whereas the parasympathetic is going to deact, it's going to reduce things.
Calm you a bit.
Yes.
Okay.
Right.
So think of it like that. It's not exactly that simple, but it's close enough.
Yeah, right.
Right. The stress can affect all parts, all function of your body, what you get out of your body, energy from the beginning of the day to the end, endurance. Mm-hmm. But stress can also affect the muscles of your structure, and it could start to, if you're in a certain position, you have a muscle, say a trapezius muscle up in here, that you're constantly doing this on the phone and writing, then you're getting that stress because you're under the fight or flight. So you're trying to get things done, you're getting the stress. The stress harbors itself in the muscle tissue.
Let's use the example when we were preparing, and I thought it was a very good one, about the rope.
If you have a pole, or say let's use a Christmas tree, and there's a rope on this side and there's a rope on this side. Well, if your tree is bent, you want to loosen up one, not touch the other one till you can bring it to level, or reduce it 2 to 1. What you want is, in the end, in the body, is a correct mid-sagittal and coronal plane, a view from the front and a view from the side.
So let's take the Christmas tree. So you have this Christmas tree
So-
that's tilted, and let's pretend that the Christmas tree is the body,
Is
and
the
we're going to
spine.
think of the spinal cord,
Right.
as what we're trying to balance, like we are the trunk
So-
of the tree.
So you don't loosen the eccentric muscles as much as you loosen the concentric muscles, the tighter muscles that's pulling the structure. You want to loosen those about 2 to 1 so that you are coming up with a balance at the end. And then all of a sudden you'll see a straight spine.
Now,
So the ones that are relaxed, you want them to stay relaxed.
You want them to stay relaxed, but you still want to get blood flow, because then there's a strengthening process that goes on after you've had, if your posture has been that way for a while, then you need to get into more, then you need to do some strengthening to assist in that,
Oh, and I think this is how this all comes together now, because here you are, we're going through our daily function. We're on the phone, we're carrying our briefcase, we're
Right.
carrying kids, we're carrying pets, whatever we're doing. We're lopsided. Now, the physical aspect is we're out of whack. And we're stressed because we're uncomfortable, we could be in pain, we're sore. So you can massage to try to relax those muscles, and doctor can touch upon what's actually happening to the body
Right.
medically, because you're going to get some negative medical effects to your health from this physically and emotionally, correct?
Correct.
There's a lot of research that shows stress is the #1 reason for tight muscles or pain. So if you're under a lot of stress, you try to do, and there's some stress you can't get out from under. If it's a job, like you said,
Right.
you got a lot of
Or
time.
you could have a death, you could have the
Exactly.
loss of a loved
Right.
one, you could have many things.
But
Illness.
what you need to do is the things that you can change, such as coffee and stimulators of the nervous system, negative attitudes, negative speech, all of those are stressors and have an adverse effect to the nervous system and to the muscles and after that.
And you know, I think negativity is such an important one, because it really is something we can control. And I don't think people realize when they're negative, or when you're around negative people, it's stressing you and making it very difficult for you to focus and stay positive, to be at your best.
Right. I remember a story when the kids were young that I would tell them that when this is moving, these are real close, they're listening. So what you tell yourself, you start believing after a while.
So true.
So if you get up in the morning and you get out of bed, the first words out of your mouth are, "Oh, I feel terrible, this could be a rotten day," you're probably going to get your wish. If you go through a
Absolutely.
day like that. So,
Absolutely.
a positive attitude is also part of de-stressing, and finding, exercise is for me, has always been a great release. Golf, anything to take your mind off. Stress is an exertion that you're doing something physical. Golf, well, it's exertion, but there's a lot of relaxation too.
Well, and let's talk about, because I think people will say, I'm stressed out, I can't exercise, I can't stay on a good diet. So one of the first things we do, human nature, is we want to go to eat these comfort foods. We want sugar, we want white flour. So Dr. Lileas, what are we actually doing to ourselves when we're consuming, and we're consuming it without being conscientious about what we're eating or how much we're eating? So why are we getting full, and why are we just all out of whack?
It's the same thing. These comfort foods are going to do the same thing that stress does. They're going to increase the cortisol production. They're going to increase the insulin production. They're going to increase your blood sugar. And then what's going to happen eventually over time is the insulin your body's producing can't keep up with the demand. And what happens, you get an insulin resistant state, diabetes develops, and what else? You start getting the fat deposits, and
Yes.
the fat deposits are usually midsection around where most people get the fat deposits. And you really, it just keeps cycling.
Why do you, or can you explain why, and that's good from the diet perspective, also exercise is so important when you're dealing with stress, to use it as a stress releaser. And I think, gentlemen, I want to talk a little bit too about, we have to train ourselves and teach ourselves, because I guess it's much easier to go grab something bad and that it tastes good, so that's easy to do and just start eating. But if you really train and teach yourself, just like you would educate yourself on any aspect of something,
Right.
the real way to deal with it is to find like an activity, as you mentioned, golf, that will get you into a de-stress state, like walking.
Right. And that's a good point too, because you can always overutilize anything you do, including exercise. For instance, the people who become so engrossed in their exercise that they're overdoing it. It's almost like it's like a drug to them. I got to keep doing this. I'm going to keep doing more and more and more. But you have to find that balance. And that's exactly what he was talking about with the balance that he's looking for in the body with massage therapy.
And then too, first of all, having shows like you have are educational. I think we need more education, because people are lost and they're getting educated in shows like this that perform. But getting back to the stress, there's also a somatic visceral and a visceral somatic reflex. So by having these high
We love your big words, but you have to put them in layman's terms. Okay.
But what that is a muscle referring to an organ, or an organ referring to a muscle.
And
So-
I love this because this has to do with the trigger points, doesn't it? When you're doing certain massage and you're touching certain, like I said, I call them trigger points.
Well, their trigger points are real, but even deeper to that, you're affecting what they call the internuntial pull in the spinal cord. So your electrical system, you're really complex. Everything's tied in some way. And so in my position, what I do is I look at the structure. They could have perfect, now, we all think of posture as just, hunching over, and that's, or like a shoulder tilt. But posture, you can have perfect posture and have a shoulder that's rolled in.
We have a great, and we'll be putting this little graphic up, but it's really interesting to me how you can see this body this is really from stress. This isn't from aging.
Right. And then there's
and
the
it's
aging,
going,
like
an aging, right? But I mean, you can really get yourself to this,
Right.
to a hunched over state, and that's where, that you can correct
Right.
with the proper, exercise, diet, and massage.
Yes, and see where I was getting to with that is you could have perfect posture but you have a shoulder that's rolled in due to maybe an injury from a weightlifting or a slip and fall where you're hyperextended and maybe overstretched the muscle. But the pains in the back, you have to know the anatomy enough to know what, first of all, the referrals are and where structures are supposed to be relative to each other also, and straight as you can, horizontal, equal to the horizon. So it's all of my work is really starts with balance.
This amazed me when we were preparing. 100% of your patients, clients, I will call them, come to you because they're in pain. You really don't even have, a clientele that just comes to you because I just want a nice massage to relax.
No, I don't now. Now at the beginning of my career.
When you were starting out and it's like, I need to build my practice.
I massaged the horse, the dog. I think you're trying to build. You just want to help everybody and anything. And they were candidates at that point. So, yes.
But you know, it's interesting when you think about that there are that many people walking around, and I know people that you've worked on, so I can speak, that you have changed their lives. But
quality.
Yeah.
Quality of life is, as we age, especially more mature in life, you find out how precious life is.
Right, and a lot of these people weren't, I know you have treated people that have injuries. A lot of these people weren't injured or sick. They made, and I know, I'm a great example. I carry a lot of mine in my traps in my, upper neck and upper
Right.
back, lower neck. And I'm like this and don't even realize it. And it's a problem. And you can hit certain points and just take me to this position. And plus, and I'm a heavy lifter for my size. And I know sometimes too, I want to challenge myself and get into the heavier weights. And that too, even though it's a positive and I'm building and toning my muscle, I'm putting myself sometimes in a tense state,
Right.
a stressful state, as, a couple days later. And that massage is wonderful to work that out.
Actually, Dr. Lileas pointed earlier, too much of any one thing is not good for you either. So you have to, you might go through a day at the beginning of the week, you were as strong as a horse. You go back to do the same exercise the same week, but at the end, your strength might not be there, so you adjust your weights to what you're capable for that day. Too many people put these expectations on themselves, some of them unreachable, but they get hurt in the process of it all. So,
Well, another good thing is I think we stress in trying to live a healthier lifestyle. We stress ourselves. Like, right?
Yes.
Isn't it? Oh my God, I ate a cookie. I'm gonna just die. I've ruined it all. So now I'm gonna eat everything I can get my hands on. Enjoy the cookie and let go.
yeah.
Or okay, so I'm gonna exercise 3 days a week instead of 5. I mean, do something, but don't make it yourself worse because
That's right.
you're gonna set this agenda that's just too demanding and too restrictive. Nobody's perfect.
And I think a lot of us put expectations on ourselves that the goals are hard. We don't set that intermediate goal to reach first before the big gun. We want to go for it all.
And you talk about shows like this, things that are important to me. Doctors like Dr. Lileas are key because when you go to them, they're going to talk to you not just about I have whatever the ailment is. They're going to talk to you about your lifestyle so that they're sort of treating that whole. But I would say, I know you and a couple of your colleagues were on the ground floor years ago of starting to, really treating people from a more holistic approach and not just for whatever the specific injury was.
Right.
How did you adopt that?
The problem with our society, I think, is, and I think Dino touched on it too, is, nobody has time for anything, and you mentioned that too. Nobody has time for anything. So even doctors in practice, they just don't have time. You got one day, you have to see so many patients in that day, and you have to have so many people each hour, and you just can't. You're okay. What are you here for? Okay, all right, we got this. All right, and you don't have time to ask them. Well, how's this? How's your life? How's your family life? Are things going okay? Somebody might come into you with stress and they look tense, and really maybe they have a child that's sick, but they don't mention that because you didn't ask that.
Right.
Yes.
So you're just, okay, my muscle's real sore. Well, why is your muscle sore? Because I'm tense because my kid's sick and I'm in the hospital every day with the kid, and so unless you develop either. And you don't have to do the entire body system every time someone comes in, but you have to try to figure out, well, why did they get that muscle problem? What happened to cause that? Was there something, was it a stressful thing? Was it a cardiac thing? Was it a muscle thing? So I think unless we look at people like that, all we're going to do is be pill pushers.
Now you bring up another great point. Interesting when we were talking a little bit in our prep about sleeping pills. You said sleeping pills will not help you to get a good night's rest, correct?
Right. I mean, sleeping pills have their place. Someone has an acute death in the family, someone dies, and they just can't sleep and they're just dragging. Okay, they need help to fall asleep. And really that's about all sleeping pills do. Most of them are very short half-lives. There are the older ones have longer half-lives and they may keep you asleep all night, but if they do, you're gonna feel like you're drunk the next morning. So what good did that do you?
Because
You
they're
slept,
not giving
but
you a
you
REM
woke
sleep?
up and you were like, oh, I can't do it.
Is it because you're not
And
getting
they
a REM?
reduce your REM sleep, actually.
I learned that from you.
Okay.
I did. I listened.
So, they're going to help you initially, but then they're going to reduce some of the good sleep, some of that REM sleep. And so when you wake up in the morning, you're either going to feel drugged, or you're not going to feel, you feel like you only slept the first part of the night, which is where most of the newer ones are.
What about some of these appetite suppressant pills?
Well, I think that if we really want to find an appetite suppressant pill, I think we have to work on, there's two hormones you got to work on. One's called leptin, produced by fat cells, and the other's called ghrelin, which is produced from the stomach. Now, ghrelin is what controls your appetite. It causes your appetite to go up or down. The higher the ghrelin, the more you're hungry. The leptin, the opposite. Now, if we could find a pill that can increase that leptin, decrease that ghrelin, we could find a good pill that's going to help people who just have horrendous appetites, just want to eat all the time. That's their stress. What's their stress? I eat all the time. I mean, people even have sleep disorders where they get up at night and eat every night. They don't even know what they're eating or how they're eating. They don't even realize they did it till morning, till somebody tells them. Those are rare, but they happen. So if you want to find a pill that's going to suppress your appetite, we got a long way to go yet, I think.
Let's talk about the leptin and the ghrelin, because I find this, and I know there are days, and being a woman, I can speak from the female perspective, you gentlemen can touch on the male, but going through the phases of life, when I was, having my periods and that time, around, there was definitely something different going on in my body. That there were days when I could eat so much more, and I would be, I wouldn't get full. Well, what was happening? Now today, and even though I am now in menopause, I find myself having many less of those types of days. But there are definitely times when I feel stressed. I know I have probably eaten enough food that I should be full, but I want to keep, and I'll eat good food, but why aren't I really, that's enough, you should be full?
Well, I think part of it has to do with hormones. Hormones are, have a whole lot to do with appetite. The adrenal glands that produce the cortisol and the adrenaline, they also interact with the pituitary in producing the sex hormones, estrogen, progesterone, testosterone. So all these things are tied in what they call the hypopituitary axis, hypothalamic pituitary axis, and that involves the adrenal glands, the pituitary gland. And what's going to happen is these hormones, they're on, most of them are on negative feedback loops. So if you're negative on your estrogen, if your estrogen used to be here and now it's here, now all of a sudden this feedback loop is different. So all these different hormones are going to change, and they're going to change a little bit each time. And sometimes it's going to get to the point where you're like, why am I doing that? Why do I feel like that? And I think a lot of it is hormonal.
Same with men?
People talk about adrenal failure. Okay, if you go to the doctor and say, I think there's something wrong with my adrenal glands, the first thing your doctor's going to do is say, I think there's something wrong with you. But because when they check your adrenal glands, they're checking for the extremes. They're checking for Addison's disease, which is decreased, cortisol production, or they're checking for Cushing's disease, which is increased cortisol production. And that's what they're going to do. They're going to do those tests that do that. And most of the time they're going to be normal. But what happens when they talk about this adrenal failure, and they're talking about maybe you're supposed to have a cortisol level of 10 in the morning, but yours is only 8. It's still normal, but maybe it's not normal for you. And see, there's no way to tell that. See, I can't do that blood test and say, Mary, you're not enough cortisol. You need more, or you got too much.
Now, do you agree that a good diet, an exercise, and massage helps to keep the body, 3 key elements that do help to keep the body from having these wacky ups and downs, because I think those are really 3 key benefits of a healthy lifestyle. I mean, what I think people sometimes fail to realize is the body is really, to me, like a machine. You know, you put bad gas in the car and bad, oil and stuff, it's going to corrode, it's going to get crappy, it's not going to run efficiently, and it's not going to look too good if you don't take care of it, over the years.
Right.
I totally agree with that. And, if you don't, give it the right fuel, if you don't eat the right diet, eventually some things, you're going to change things in your body. Whether you become a diabetic, whether your cholesterol goes up too much, and then what's going to happen? Then you're going to be worried about, now I'm getting fat, I can't do this, now I can't exercise. So then you got this stress cycle again, the cortisol, the adrenaline, everything's going up, and things are just getting worse and worse and worse. You have to find a way to stop
Your
it.
way.
Yes.
I tell
You have
people
to
that.
find it.
Yeah, I tell people about exercise. You don't have to run, ride a bike, do an elliptical. You need a cardio workout, right? We want to get your heart rate up and get you moving. Walk. You don't like walking? Ride a bike. You don't like riding a bike? Get on find something that you can, if you don't like it, that you can tolerate.
Right.
And find a place. Don't, stick a piece of exercise equipment in a dingy basement.
Right.
Put it somewhere where you like to go. Put a TV or where you have music, something that's
Right.
going to keep. I think we need to take responsibility. Where I'm going with all this is there are so many things we can do to control our stress, which ultimately will control our health and give us a better lifestyle. But we got to take ownership of it,
Right.
and then reach out to the resources to help us find what works for us.
I'd like to interject somewhere there is, too, when you're starting a new exercise program, let's say, or you want to go on to a specific diet. I hate the word diet.
I do too.
I like lifestyle, But first, you start slow. You don't start high until you're fatigued. You start out to where you can, raise your heart rate a little, but not to where you would if you're really in shape. Also, proper mechanics, things of that sort are real good. And I was going to say something, and I just lost it.
We'll
but
get
I'll
back
come
to you. Don't
to
worry.
that.
We'll get to it.
One of the things, though, and I'm sure in your work is, if you're doing something from an exercise standpoint and it hurts,
Right.
don't do it, right?
Right.
I mean,
Right.
or
Bingo.
find a different way or do less. If you're lifting weights and it hurts when you lift with this arm, then go to a lower weight or
Right.
do something.
Form is key.
Form is key.
Not weight, form.
That's very, very true. And if you do something, even if you're starting off with a 15-minute workout a day, you do something long enough, it becomes habit. So if you can interject and just take any moment, any minute you have free and start something, sooner or later you'll find yourself, that's part of your routine.
Absolutely.
So, and nobody likes change, but so start off slow so you don't get bored with it and quit.
This whole stress, mind, body, health connection, I want to ask you about something that we were talking about, again in our prep. The Arndt-Schultz law.
Right.
Explain to us what that is.
What that states, Arndt-Schultz law, is weak stimuli, which the body favors.
Meaning?
It likes to be low. We're talking sympathetic and parasympathetic.
Okay.
Nerve ganglion. But the body likes the weak stress because it assists in physiology.
In bodily functions.
Yes. The body does not like high stress because it inhibits bodily, physiology. So that basically is, so the whole, when you're stressed out, and you're getting your nervous system in high energy, first, the two main areas in your body that produce or use most energy are your muscular skeletal system and your digestive tract.
That's what I want to tie together because that's very important.
Well, with the fight or flight, you're not thinking of eating. You're thinking about taking
Running.
care of the situation and running.
Right.
So your energy is not placed there. Your mind's focused to strength, to whatever you need muscularly to get that job done. And that's why chronic pain patients, there's been research out there how solid it is, but they say they don't digest or assimilate their food, get the same nutrients out of it that they would have in a healthy body.
Yeah, touch upon that because there's something to be said about people that aren't when you're in a calmer state or a healthier state. When you take good food in, you get the benefit of.
Right, you absorb the food.
Right.
Better,
Why aren't people when you're in a high stress state, right? You're not absorbing. You could be eating. You're not absorbing the nutrients. And I know you gave us the scientific reason involving the cortisol and so on. But the digestive system isn't functioning properly, right?
Again, yeah, because what happens is, you got this cortisol and this adrenaline, that continues these small little blips, and it's going to places that it knows can save your life, your heart, your brain, your kidneys. The digestive tract, it doesn't, it's not going to save my life. So it's going to move everything away from that, and it's going to put it to the organs that it knows it's going to be able to save your life, to your muscles to run away in the fight or flight, for instance. So the digestive tract kind of suffers, and I think that's why a lot of times people turn to wanting to eat as a comfort food because it tastes good and it doesn't take much to digest it.
Every function, I'm going to read something. Every function in our body is due to an electrical response from our nervous system. Basically, we are electrical before we are chemical.
In other words, for any kind of hormone to be, before it's produced, there has to be an electrical stimulation. There's an electrical response to all that. Every time you move your arm, there's an electrical response from the nervous system. And in muscle case, the movement comes from the motor nerve, and the motor nerve responds to a sensory nerve, which is it's from the muscle to the brain, and then the brain sends it back in a motor nerve route. So,
medically,
so intermixed with the electrical stimuli are the neurotransmitters, which can be produced from various, from your hypothalamus, little gland in your head, from your pituitary, from your adrenal glands. And what these neurotransmitters do is they go to certain places to say, okay, we need more hormone, we need more adrenaline, we need more cortisol, we need more testosterone. So between the neurotransmitters and the electrical signals, that's how everything works.
how can we control them or make them better? Can we?
I think that the only way we can do that is to live a healthy lifestyle. Don't overeat certain foods like carbohydrates and simple sugars and unrefined sugars and things like that, or refined sugars, I should say. You want to try to eat something that's well balanced, fruits and vegetables. You want to eat, okay, if you're going to eat meat, eat lean meat. If you're going to eat sugar, eat very little of it. Yeah, you can have a cookie, enjoy it when you have it, but don't make a habit of eating dinner by eating a box of cookies.
Do you agree with me that no two bodies are alike? Some people have larger appetites than others. And you learn to manage it, know your body. Some people, want to eat 6 times a day. Some people would rather eat 3 times a day. I'm not a proponent of once a day,
Right.
But but it's like anything. I think there are certain basics that we adhere to. Then you got to find what works. You're not going to go out there. We spend billions of dollars on supplements and on diets and on exercise equipment and everybody thinks, well, this worked. Well, this worked for me. Well, maybe if it worked for them, you have to figure out you. And then you've got, and I'm a good example. I don't eat red meat because not because I think it's so bad for you. I think in moderation it's great. I'm a big eater. I like to eat. I'd rather eat 2 or 3 times as much fish instead of a little piece of red meat.
Right.
So that's how I ended up many years ago making the choice of I'm not going to eat red meat because then I can get more fish. And that's why I eat so many vegetables. But I mean, I'm one of those people that really, I have a great appetite, but you have to learn to manage it.
Well, I found what works best for me back in the day where I was trying to keep in shape and, to eating smaller meals, 2 to 3 hours apart, always putting something in there. And I don't, even now, my wife and I, we don't eat past full. When you're full, get a doggy bag, take it home. I don't eat, I try. I don't always achieve that.
You are the man. That's a tough one, but I admire that.
But yeah, we have started that, and it's very helpful, and that's not hard to do. Anybody
Well,
can
here's
do
why
that.
it's hard to do, and it goes back to the stress thing. First of all, we're programmed. We eat what's on our plate.
We were told that's how
my
we grew
grandmother,
up.
right? It's my Italian grandmother. You eat when you're happy. You eat when you're sad. You eat when you're upset. You eat when you celebrate. We eat, right?
And if you don't
And if I
finish,
don't
you
eat what's
like
on my
it.
if I don't eat what's on my plate, you don't like it. You're not having another helping,
Yeah.
right?
There's kids starving.
Yeah.
Somewhere.
Yes.
I didn't know me eating like all of this is gonna, help. God bless, help those poor people. But really, yeah, they.
Yeah.
But so much of eating too. I think starts. Stress is number one, and I think too. So much of it starts here. It doesn't start in your mouth.
Oh,
And
absolutely.
it doesn't start in the gym. It's got to start in your head.
Right.
And I think that's something
And
that.
the important thing about that is, if you see in your life that, all these different stresses, or maybe you're just not even sure what the stress is, but you know that you're constantly, you look sad, your posture's stooped over, and, people notice, hey, what's wrong today? Oh, nothing, And if you can't find that, then you better go to somebody who can help you.
That's right.
Great point. Yes. Yes.
And
yes.
the thing about it is you have to watch who you go to.
Yes.
Because I think sometimes people are so, they're so quick to throw you on, here, take this antidepressant, you need this, And maybe you do. But the effects of the antidepressants, too, are going to take its toll on you. So I think that if you're going to look at that, you want to find someone who's going to talk to you and try to get to the root of whatever the problem is, whether it's emotional, relationship, physical. If it's physical, you need a full physical. Go to the doctor, get a good physical. If he says everything's okay, then go see somebody.
And I think this is a great stressor in our world too. People feel uncomfortable. I want to go talk to a counselor.
Right.
I want to go talk to a psychologist. And just like in a relationship, a friend, a dating relationship, you have to find people you click with. So just
Right.
because somebody has a title doesn't mean that that's the appropriate person for you.
Right.
Interview, find who you click well with. But I think it's so sad in our world that we look down upon that. And and I'm a person who's such a huge fan of counseling. Rose Mimo's been on my show. I mean, she's my go-to person. But my point being, I think everybody needs a little bit of coaching, and nobody's perfect. Nobody can deal with it all on their own. And if you don't have that support system, maybe in a spouse or a friend, and even if you do, maybe reaching out to somebody like that could change your life and just getting you de-stressed.
Right. Well, I think we'll all agree on. I think as an individual or a family, you should have a healthcare team that you're comfortable
Yes.
with. A good physician, starting with that,
Yes.
because they can lead you in directions. You know, a therapist, a counselor, but feel comfortable. And like you said, interview. It's the best way to do
Yeah.
it. But I think
Right.
it's nice, and you said something earlier, and that would help also with a complete, if I notice something, I can contact or call the doctor and say, you know, I noticed this, maybe you want to look at this. Or he could say, you know, I think this is no more than a tissue problem. Can you take a look? You know what I mean? And
Yes.
so it's just, and it's just a team effort
Yes.
in your health.
I'm going to go through some stress reduction tips, and you gentlemen can comment on that.
Okay.
I just naturally, I pulled off the internet, you know, in my preparation. Breathing, of course, is an easy one because I know, you know, I try to tell
Relaxation.
people. Right. Inhale through the nose. Nice, deep breaths. Blow it out through the mouth. Close your eyes. My
Good
last
key
one's
to that.
meditation. Go ahead.
When you're breathing in, your diaphragm should drop, so your stomach should actually go out. A lot of people get that backward. You allow that diaphragm to drop, that allows the lung to fill up to their capacity. And that's why a bent posture like this, there's a lot of strain on that area, and it's just like a cymbal, like when you hit a cymbal, but as soon as you put your finger on it, you don't get that vibrational effect. Well, for instance, your digestive tract or your colon, there's a peristaltic action, and that's a part of a vibrational movement. So if there's pressure on that, you're not going to get the same response out of that organ.
Right.
So a deep breath should be in through the nose. Get
In
demo
through- in
because
through
people
nose.
really don't know how to breathe.
No, you're right. You're absolutely right.
Demo
You breathe
that.
in through your nose, extend, and then out.
And it's a little bit of
And
an
then
abdominal
as you breathe in out,
exercise.
yes,
Right.
you can feel that diaphragm coming out, and that's forcing that
Air
air out of your lungs. Yeah.
Massage, which we've all, you know, we've talked about, and the benefits, and you know, it's just so important. Reach for soothing scents. Calm the nerves. Try inhaling like bergamot. I hope I'm pronouncing that correct. I know the T. I'm not sure how to pronounce it. Lavender,
Lavender,
peppermint oils. I know
lavender's
lavender is calming. What's your opinion on that, doctor?
I think the lavender is calming. I don't know about the peppermint though.
But do you believe that
Well, it's-
scents can?
I
Oh, yes.
believe and have been taught the ophthalmic gland is the most direct way into the brain. So your
Olfactory.
olfactory. I'm sorry.
That's okay.
So yes, I think it can be very stimulating in one way, you know, in a high stimulation or calm somebody down. Like the spearmint or eucalyptus, I think that's more of a upper, isn't it?
Right.
And you know, Google, you know, scents, and you can find different oils and different scents for different reasons. Like you say, what do you want to calm you down? What do you want maybe that, you know, before you exercise or you want to get motivated to take a walk, maybe, that, you know, find the things that help you, you know, to get a little more upbeat about that. I'm a firm believer, a relaxing warm bath. I like, you know, if you're fortunate enough to have a whirlpool around, I think, you know, that can be relaxing.
I like hot tub.
Well,
Yeah.
But
Yeah.
I can tell you how many nights, and this is current. I go home, my wife will have a hot bath started with Epsom salts in. Just because I'm sore sometimes at the end of the day. If you get a lot of big guys, muscle,
Yeah.
football, you know, or just big people in general, you're whipped when you get home after 9 patients a day or 10 or whatever, you know.
Yeah.
So I think it's, and plus I like water. Water is soothing to me. Especially
It
the ocean.
is. Yes, the ocean is lovely. Unfortunately, it's
We don't
really
have
not
one.
around. We can always go to the lake club though, and at least they have a beautiful view of the lake,
There
right?
you go.
Dr. Lileas, we've heard of the runner's high. The high comes from the endorphins that our brains produce when we get the heart pumping. Just touch on that real quick so that people really understand it. We hear it.
The endorphins are our body's morphine. Okay, so we, you know, your body has natural painkillers, and those are the endorphins. And in some people who if they do something they really love and it's something that makes them feel good, these endorphins are produced more. And they're direct neurostimulants. And as a neurostimulant, they'll affect your entire body. So it's like a neurotransmitter.
Mm-hmm.
So the runners who really enjoy what they're doing, and they feel a very calming effect.
And you can get that walking, can't you?
Yes.
A nice brisk walk.
Yeah.
And I tell people when they're walking too, hey, it's great to walk with somebody, but if you're working or walking with somebody that walks very, very slow, and you can keep a better pace, it's good to, a buddy. The buddy system's great for people that want to work out with somebody to keep you motivated and so on. But you may want to do your own walk before you walk with your buddy if your buddy is at a much slower pace, because you want to get your so-called workout in at your pace, and then it's great to continue, with the buddy.
Otherwise, you're making the walk a stressful thing, because I want to go this fast, but he wants to go this fast, and so that now it's stressful.
Yes, exactly.
So
meditation. I'm a believer in meditation. I've never really had formal meditation.
Right.
I've learned how to meditate, and I find it very helpful. And my simple technique, you meditate. I don't know if you do, Dr. Mike.
I did at one point, but I don't anymore. I don't know why. It's just,
It's
like
time.
a habit you get into or don't get into. But when I was in medical school, I read a book by a guy named Herbert Benson. He was a MD from Harvard, and he wrote a book called The Relaxation Response. And it was all about meditating and being able to treat someone's blood pressure, heart rate, based solely on meditation, not on any drugs. We had very good results. It's still in print.
And I have to say, I'm one of these people who, I'm not faithful about it every day like I wish I could say I was, but I find myself when I feel like I'm stressed, or I feel like, or I need to get my focus, I'm going into, not even that necessarily I'm stressed, a lot of times, I'm going in 4 or 5 different directions and have 4 or 5 different things going on. I'm like, whoa, got to pull it together, compartmentalize each one, let's focus and take a deep breath. And I find it very helpful. And simple meditation, sitting by yourself calmly in a comfortable position, nice deep breaths, close your eyes and imagine something very soothing and comforting.
And that doesn't have to be. You can get so good with that, with practice. You can get more out of, if you're at work or between your patients, you just came from somebody that just got you really going. You can get so good with that. You can go in and in a few minutes get yourself in that calm state where your mind's free, breathe, clear yourself, then you can go out and you can be yourself with the next person.
Absolutely.
You know what I mean? So I got to say, I do that a lot, and I use my morning prayer is my time to just clear my head. So.
And and if you have a faith, I think that's fantastic. I do, but I think it's a very personal thing. But I find that very comforting and very, for me, and a source of strength. But another thing though, like when sometimes I'm feeling like I'm just all over the place, take a deep breath. I go outside and I just take a walk. I'll walk outside, even if it's only 5 minutes around the building. Just need to or if I'm upset about something, just to pull it together sometimes. I mean, little simple things like that can be so important to reducing and managing. Like I said, you can't eliminate stress. Right. We got to learn to manage it, and we got to take responsibility and ownership of our health and that aspect of it.
Well, you need to also, I think is important, be comfortable where your little place of peace
Yes.
is. Find a place in your office or at home. Some people use their car. They can say, but find that place that you can get there. You can't have a bunch of noise and a bunch of conversations going on around you, and kids running around or dogs running around. Sorry, but you're not going to get there. You need to have a place where you can go that's yours.
If you have any advice for the viewers to walk away with today, any 1 or 2 points you want to close with?
Identify your stressors and figure out how to get rid of them. And if you can't figure it out, find some help. I think that's the way to go.
Awesome.
start by getting happy with who you are. Like yourself. And I'm not talking egotistical. I'm just saying like who you are and start somewhere. And have a positive direction. Like have a positive attitude to get you there. And if you have to work on it, maybe there's something you can just give yourself a reminder through. Just a little saying that you say, all right, stay focused. Maybe just that, but start somewhere. You know what I mean? Don't sit there and expect that you're going to have manna from heaven come down and heal you. You know what I mean?
Right,
If you got a stress, then you have to be part of that team that we talked about earlier.
Yes. And you know, that team can include a dietitian.
Oh, sure.
And an exercise trainer just to get you started.
Sure.
Dino, we're gonna have it posted, but if you have questions for Dino or you'd like to make an appointment, Ruse's Massotherapy Center phone number is
330-758-1975.
and you are located
755 Boardman Canfield Road in Southbridge West.
so you're not too far away. We'd love to say you can send questions for Dr. Lileas to info@thefitnest, but now that he's a hospitalist and a teacher and a mentor, and I know you gave up patients, but I get to at least call you once in a while if I need it. So I'm very fortunate to have a line to you. It's been fantastic. My one thing I think I want people to remember is, be trying to think about doing something, an activity, take a walk, ride a bike, try to avoid, refined and processed foods. I think those two, couple things, a little activity and avoiding refined and processed. I'd rather see people eat a little more of, a natural food, even if it's few more calories than the refined and processed stuff. And I think those things just help to keep the body in balance. Dr. Michael Lileas, Dino Ruse, I'm Mary Pepino. Thank you all for watching, and I hope you enjoyed the show. Have a fabulous, restful, de-stressed time.